Welcome, 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 family, friends, community leaders, healthcare professionals, and the people to Minding the Mentals, mental, behavioral, and developmental care for the family. I am your host, Shanti Das, founder of Silence to Shame Incorporated. It is such an honor and pleasure to be here tonight. And so I hope that you will take away all this wonderful information, take it back into your communities, your offices, share with your colleagues and family members, because we're going to share some amazing information tonight. This is number 6 of a series of 8 candid COVID convos brought to you by Alive and In Color. Before I go any further, I'd like to personally thank my team at Silence to Shame, the BLK+Cross, and the Gathering Spot for partnering with Alive and In Color and lending their platforms to this important cause. Now, the purpose of tonight's conversation is to provide a trusted space for our community to engage with experts for a better understanding of the realities of COVID-19 and its impact on communities of color. Communities of color are facing severe impacts on their mental health and psychosocial well-being due to COVID-19. Psychological distress is widespread due to 1, immediate effects of the virus on health, 2, consequences of measures to contain the spread, such as physical isolation and suspension of services, and 3, the worries about loss of livelihoods and education. Minding the Mentals will explore the psychosocial impact of the COVID-19, 2, the urgent need for mental and behavioral health care in our communities, and 3, barrier-free resources available to help mitigate this mental and behavioral health crisis. Once again, welcome. Grab your tea, grab your coffee, get your notepads. Again, it's going to be some incredible information for you to take back. So sit back, relax, and let's get going. I'd love to introduce our incredible and esteemed panelists that we have for tonight. So I am going to introduce them and then give them about 30 seconds to a minute to share a little bit about their backgrounds. So first, I would like to start with Ms. Latrina R. Foster. She is the director of Fulton County Department of Behavioral Health and Developmental Disabilities. Welcome, Latrina.
Thank you. It is my pleasure to be here tonight. I'm just excited to be a part of this robust conversation. I am a licensed professional counselor. I have been doing individual, family, and group therapy for, I'll say, 20 plus years. I don't want to put the exact number. And I've been with Fulton County government now for 13 years. Started off as their performance and quality improvement manager, transitioned into their director of clinical services, and now I am the department head for the Department of Behavioral Health and Developmental Disabilities. Thank you.
Thank you, and it's an honor to share the virtual stage with you again. So I look forward to all that you have to share, Latrina. Next up is a dear friend and colleague who we've done a lot of work with in the past with Silence to Shame. Let's welcome Dr. Sultan Sims. He is the immediate past president of the Georgia Psychiatric Physician Association. Welcome, Sultan.
Thank you, Shanti. Good evening, everybody. I'm really excited to be a part of another great discussion. I am a psychiatrist, been practicing about 15 plus years. Spent about 9-10 years in community mental health with Latrina and the Fulton County Department of Behavioral Health. I'm back in the clinic, but also having fun, but also I've been in managed care for about 6 years. I've had a few executive level positions there. So hopefully I can bring that perspective to the conversation. Well, again,
it's an honor to be here with you. And thank you again for all that you do in our community. We really appreciate you. Next up, another friend of mine. I swear, I feel like I'm at homecoming or something, hanging out with old friends. This is awesome. So many experts in the mental health field that I've worked with in the past. So I'd like to welcome Dr. Felicia Berry Mitchell. She is a psychologist, author, and speaker. I can't hear you.
Yeah. Good evening, everyone. Thank you for joining us, and I'm happy to be here. I am a licensed psychologist in Georgia, and my specialty is trauma. I've worked about 5 years. I've worked about 5 years in the VA, and the last 7 years of practice have been independent in private practice with the hopes and plans to open a residential program specifically for trauma. And I'm excited to be here. Thank you.
We are so excited to have you. You know, you've been featured on our Silence to Shame podcast, and you certainly have so much information to share around trauma And we know that our nation has been traumatized this year, amongst other things. So we certainly welcome you this evening. So thank you again for joining us.
Thank you.
Next, we have Ivan Barclay. He is an LPC, and he's the co-founder and CEO of Barclay Light and Wellness. Welcome, Ivan.
Good evening, everyone. It is just an honor to be a part of this panel, the Silence the Shame movement. Again, I am a licensed professional counselor, graduate of Morehouse and University of West Georgia. I have my own practice, Barclay Light and Wellness. It has been in existence for over 10 years now, particularly specializing in the development of wraparound programs for Fulton County schools, DeKalb County schools, in support of our children and youth, but we also service adults.
Awesome. Well, thank you again for your work in our community as well. Looking forward to hearing what you have to add to the conversation tonight.
Absolutely.
And last but not least, we have Dr. Gigi Bastian. She's a PhD licensed clinical psychologist, associate director in the Office of Global Health and Equity, and assistant professor in the Department of Psychiatry and Behavioral Sciences at Morehouse School of Medicine. Welcome, Dr. Bastian.
Thank you so much, Shanti. It's a pleasure to be among such experts in the field, and really looking forward to a great discussion. As Shanti mentioned, I'm a licensed clinical psychologist. I share my colleagues' focus around trauma. My particular line of research has been in the aftermath of disasters and emergencies. So COVID has been an interesting time to be doing that work here in the States instead of internationally, where I typically am doing disaster response work. So looking forward to sharing some remarks from that perspective.
Awesome. And we just thank you for your work on the ground. You are one of our center heroes. So thank you again for joining us and participating tonight. All right, let's jump right in. A couple of housekeeping rules. Panelists, I ask that you keep all responses concise and respect each other by allowing everyone to answer the question before you chime in. And if you do want to chime in, just simply raise your hand and I'll make a note to allow you to respond after each respective panelist. So let's get to some of the facts. I want to read a quote from Gabrielle Union in Women's Health. The combination of a pandemic and this racial reckoning, alongside being inundated with images of the brutalization of Black bodies, has sent my PTSD into overdrive, she said. Stress from COVID-19, along with stress related to healthcare, the economy, racism, and the presidential election, have Black Americans facing what the head of the APA, Brian Smedley, calls a mental health tsunami. Even before the pandemic, we know that suicide was the third leading cause of death amongst Black males aged 1 to 19 in 2017, and the fourth leading cause of death among Black males ages 20 to 44, according to the CDC. Recent stats show our mental health is rapidly declining. Now, there was a recent survey done from the Circle of Trust. It was conducted by Fulton County and the BLK+Cross, and they found that 56% of Black respondents indicated that they felt anxious at least one day this week. 50% felt depressed, and 52% indicated feelings of being alone or loneliness. A national CDC study on mental health and substance abuse during COVID-19, filed in June of 2020, found that 15% of Black survey respondents in late June had seriously considered suicide in the past 30 days, compared to about 8% of whites. Black Americans are 2 times more likely than white and Asian populations, non-Latinx, to abuse substances as a way to cope with COVID-19, stress-related emotions and stress. In Atlanta, during the week of April 12th, 2020, the Atlanta Police Department saw domestic violence cases jump by more than 400% compared to the same week last year. Between April 12th and April 25th, there were 46 reports of domestic violence compared to 14 during the same time period in 2019. Reports remain up 17% over a 3-month span. So let's get right into it. I'll shoot to you first, Dr. Sims. From what I understand, medical experts are learning more and more about how COVID-19 can have a direct impact on mental health, causing both physiological and mental health issues. Can you tell us what you and your colleagues are seeing as it relates to this?
Well, we're seeing, my first comment is we're still learning. There's more research that needs to be done, but there's some evidence that there are some neurological brain effects of COVID-19. I think most people have heard of the reports of loss of taste, loss of smell. We're also hearing issues related to focus, concentration, fatigue, and other odd symptoms that both happen during active symptoms from infection, and then post recovery, these symptoms continue. We're seeing a lot of variability. I was speaking to someone who mentioned that their son who recovered, they're going to take their COVID nap. It's like, since they've had COVID every day, all of a sudden now this young person is having to take a nap every day, when that wasn't the case before. So we're hearing more and more about these odd things. In terms of depression, anxiety, it's not so clear if the virus itself is causing these things or the issues related to job loss, fear, anxiety, a family member who's died. There's a lot that's going on around COVID-19. And a big point I want to make is, you hear a lot out there about, oh, it's just like the regular flu. It's no big deal. This is a big deal. This is not the regular flu. We don't even fully understand it yet. So I just really want to communicate that message to people to continue to stay safe and to do everything you can not to get it, because we're not sure what the long-term effects are.
Thank you for that. And if you're like me, I have my gloves, my napkins, my wipes. I mean, my front car seat, I have my entire COVID pack. So I certainly understand in terms of heeding the warning of staying safe as much as we can. Does anyone else want to add to what Dr. Sims responded to? All right, we'll move on to the psychological impact of COVID. That was kind of going to lead me to Dr. Barry Mitchell. Dr. Sims talked about, the effects, after someone has contracted COVID. So I just want to start by saying, a lot of us in the Black community, we take our strength and resilience for granted. And sometimes we think, that we cannot experience mental health mental health challenges, right? And stress. Being Black is hazardous to one's health, and that includes mental health. In fact, more than 20 cities and counties and at least 3 states in Michigan, Ohio, and Wisconsin have declared racism as a public health crisis. And on November 16th, the AMA did the same. Before we get into COVID specifics, can you talk a little bit about that, Dr. Berry?
Yes, so there has been a lot of research about race-based trauma, and Robert Carter introduced this concept of race-based traumatic stress. And it's very similar, the symptoms present very similar to what we would see in post-traumatic stress disorder, or PTSD. So people might, if you've experienced an encounter, a racial encounter that was sudden or unexpected, and it caused emotional pain, and it was outside of the individual's control, that was their perception of this racial encounter. They often had avoidance symptoms. They had intrusions, which we would consider like nightmares, intrusive thoughts, not being able to kind of get away from the event, if you will, as well as some of those, arousal symptoms. So being on alert, like we know, like we've often heard, right? I'm driving down the street, a cop pulls in, is behind me, and there's automatically this reflex of tension that we might feel even in our bodies, right? As well as the anxiety. So that race-based traumatic stress is something that we know exists as it relates to not just COVID. And you look at how African Americans, Black people have higher rates of COVID, that you can look at some of the systemic reactions to, oh, it's not that big of a deal, because we believe is because it affects people of color. If they're like, we can relate it to like the opioid versus crack epidemic, right? That crack and cocaine were very similar, but how it was treated, how we respond to opioid is very different. Same way with COVID. If we were to see rates of infections or deaths related to non-people of color, I think the response would be very different than it's not just the regular flu. So there are all these different situations that lead to the stress that we might feel in our community.
Thank you. Would anyone else like to add to that?
I would just add, if we have a couple seconds, I would just add, I think there's a lot being done. People smarter than me in terms of the research. I'm happy to see that more and more, this is being talked about more. Finding I've been involved in a lot of talks about kind of protecting our mental health and what Black people have dealt with when it comes to racial trauma. And I'm hopeful that there'll be some progress. There'll be some more of these uncomfortable conversations. And I was in a meeting the other day, and it was an uncomfortable conversation. I reminded all the folks who weren't Black to just imagine what it's like to be on the other end of some racism. Just imagine how uncomfortable that is. So what you're feeling right now, we've been there. So let's continue to be uncomfortable and do the work that's necessary.
Yeah, it's a tough time. A lot of my friends who work in corporate America, right, who hold positions, whether it's in marketing, or other areas of the company, and they're having to be, on the spot D&I folks, right? And it's like, okay, I wasn't hired as a diversity and inclusion person, and that's adding a level of stress, to their job, in senior level management. So yeah, there's certainly a lot going on in our community. I'd like to next go into the syndemic. Even before the pandemic, the Black community was experiencing significant mental health disparities. Now we are experiencing what experts call the syndemic, with the convergence of numerous stressors. Dr. Bastian, we know you have a specific expertise in disaster mental health. Can you tell us some of the key stressors driving this mental health tsunami?
Sure. Thank you for the question. And I appreciate a lot of the remarks that have already been made by my co-panelists, highlighting the magnitude and the range of stressors that our global community is facing right now. And I think with COVID, you have the perfect storm of heightening up and increasing of demands on our psychic resources, right? So we're having to be more vigilant, more aware of our movements, more conscious of cleanliness around us to keep safe, with worries and fears about contracting the virus, about our families potentially being exposed. We're worried about the older adults in our lives. We're worried about the children who are at home doing homeschooling and what have you. So you've got all of these factors that are ramping up the stress, to much higher than typical levels for us, while simultaneously you have limited access to the things we typically look to cope, right? So we're not as able to gather in groups, to go to the church, to get together with that group of homegirls, to vent and find ways to sort of de-stress. And so we're having to get really creative about how to manage all of that. But I really think, in addition to those variables, the fact that you've got these essentially twin pandemics in play in the U.S. context anyway, where you've got the pandemic in addition to a stirring up of these racial sort of tensions that is introducing a lot of added difficulties for communities of color, really compounds what was already a challenging mental health picture. And so I think all of those things speak to us having to be especially vigilant about mental health right now, and especially vocal as a community about normalizing talking about mental health, normalizing acknowledging we're not okay right now, and making those resources available to our community. But I'm hopeful that the fact that we're, as a collective society, being challenged by these things will facilitate some comfort acknowledging this is a lot, and we could use some additional supports to kind of get through.
Yeah, it's funny, I certainly can see and recognize the stresses in my life. Even, you talked about not being able to go to church. I'm a member of Ebenezer Baptist Church, and I like to go on Sundays, right, to fellowship. And I've been watching church on my computer, and that's great. But I put, a little prayer pause reminder on my phones just so I could hear church bells. And I pray every day at 12 and 4, and trying to find different ways that I can recognize through my feelings. And I came up with the term rap, right? We all need to rap. What does that mean? You need to recognize your feelings, right? But then when you recognize them, you have to acknowledge and really accept them, that you're having those feelings, right? And then you need to process through them. So, hopefully you guys can use that term rap and be able to recognize those stressors and feelings in your life. Now, I want to ask you, Dr. Sims, you see things from the other side of the equation, rather. Are you seeing an uptick in mental illness or behavioral health issues among the patients your organization ensures?
Well, just kind of speaking to the trends that we're seeing in the managed care world and in the insurance industry, I think what we initially saw was a decrease in people going into 24-hour settings, or even just going out to a regular outpatient visit. People were being told not to come in. That was a part of containing the spread of the virus. But I think one of the biggest things that have happened is that we've seen an increase in access to outpatient care, particularly because of the use of virtual health, the use of telehealth. There's a lot of rules. Most people aren't aware of the rules around telehealth and the barriers that some of those rules created. For example, you could see a doctor who's in another state, but you would have to drive to an originating site to sit there so that you can access that doctor in another state. So rules like that have been relaxed in the pandemic. Behavioral health, in my experience, 80, 90% of the telehealth utilization was already mental health, behavioral health. So we're really well set up to kind of take advantage of the loosening of those rules. So I have seen some improved access to outpatient behavioral health services. I think it was bumpy at the beginning, but my colleagues, and it's confusing because there are different rules. CMS, the Department of Insurance, the Department of Behavioral Health and Developmental Disabilities, DCH, the Department of Community Health, they all kind of govern different areas of insurance. So, but I think we got it together, and I think we see things kind of trending up in terms of access to services.
That's good, because we know it certainly can be tough on folks, especially in rural communities, right? That don't have that same access. So we appreciate the work that you and your
real quick, I don't want to make it too rosy of a picture because we still got workforce issues. We need more social workers and LPCs and psychiatrists. So that's still a part of the equation. So, sorry to interrupt.
No, thank you. I think that's a great point. I think part of what we want to do is make sure that, from a Black and brown perspective, for sure, that we have more young students, right, who are looking to become clinicians and experts like yourselves. So we want to continue to uplift you all, and, shout out to Taraji P. Henson's foundation, because they are starting to award scholarships for young people of color to actually go to college or to get their master's, to go on to become mental health experts. So certainly we hope that we will see an influx, if you will, of students, going in and actually studying to become behavioral health clinicians. Next, I want to talk about mental and behavioral health in the most vulnerable populations. A case can be made for all of us to seek care for our mental health, but we also know some of our most vulnerable populations are experiencing the impacts even more severely. They are 1, the elderly, 2, kids and adolescents, and 3, women. Ivan, help us to understand why this is a particularly troubling time for the elders of our community. If you can unmute, Ivan. Okay.
Yes. Well, Shanti, at this point, we've been told by countless times by Dr. Fauci and other medical doctors that people over the age of 65 with pre-existing health conditions are substantially at higher risk of experiencing those life-threatening or fatal complications with COVID-19. One case in point for me that is very personal is my father-in-law, who is 69 years of age. He's a member of my household along with my wife and daughter. And he's a chronic smoker. And he's also challenged with type 2 diabetes. Because of his health complications, he's certainly more likely to experience those fatal complications that come along with getting, COVID-19 than someone who is younger or healthier. He's aware of these health conditions and the risk factors that come along with getting COVID-19. He wears his mask as he goes out to, take care of errands or going to the doctor. But in addition to that, he has this anxiety because there's these uncertain variables that come along with these precautions. And that is, you can't really control everybody else in the household. You know, for example, my wife, she has a chiropractic business. And on a good day, she can see well over 100 patients. You know, now, of course, she's wearing her mask in her office, but she's far more likely to get the virus than somebody who is, for example, sheltering in place. So not being able to, you know, account for those various uncertain variables heightens my father-in-law's anxiety. And so this case in point speaks to our elders in general. Anxiety and depression have increased amongst our elders overall due to this pandemic and syndemic. And they're inextricably dependent on us to do what we're supposed to do, to wear that mask. And so, you know, overall, it's important for them to connect with healthcare professionals that can support them with managing the anxiety or the depression or any other challenges that come along with this pandemic syndemic.
Absolutely. I can relate. My mother is 89. She's in a facility in Charlotte, and she also has Alzheimer's. And so I have only seen her physically twice. Her facility did purchase iPads, so we're able to FaceTime once a week, but she's asking me every week, when are you coming? When are you coming? She cannot understand that. And, you know, it just broke my heart to not see my mom, you know, for Thanksgiving or even for her birthday. And I try to FaceTime as much as I can, but we're really only allowed to a week, but sometimes they'll sneak and let me do it. But I don't want my mom to become depressed, but I know that, you know, the elderly population, they are more at risk, right? And more susceptible to COVID-19, but it just puts families in a tough situation. So then you talk about those added layers of stressors, not only on the elderly, but then on, you know, the caregivers that were once there for them that can't be there. It's just a real bad trickle down effect from an emotional, you know, health and wellness perspective on the entire family. Would you say?
Absolutely. Absolutely.
Yeah. It's really tough. Okay. So pre-COVID, a Congressional Black Caucus report released late last year noted that suicide rates among Black youth nearly doubled from 2007 to 2017, and that Black children under 13 are twice as likely to die by suicide than their white peers. Ivan, what are you seeing here in Fulton County specifically as it relates to the mental health of our women and children? How is that impacting the overall family?
This is a good question. You know, as I mentioned earlier, I provide wraparound services. My company provides wraparound services for Fulton County schools. So we are seeing suicidal ideation at the very least in the school. You know, one of my clients who is a Black male, 11 years of age, he recently was petitioning on a social media platform for his peers to help him end his life. Yeah. This virtual communication was occurring while he was at the school. Unfortunately, a school administrator was able to intervene.
Thank God.
Yeah. Of course, you know, the school administrator contacted his mother, who is the only parent in the household. Now, his mother is stressed out and overwhelmed, you know, doesn't know what to do. You know, of course, talking to me, she was encouraged and told to immediately take him to the hospital for a mental health assessment. Meanwhile, she's struggling to care for her other 4 children as she's trying to take him to the hospital. Wow. You know, what I'm learning is that this young man, this child, is traumatized with the abandonment of his father not being in the home. You know, he's wondering why his dad is not visiting him like he used to. And in his 11-year-old mind, he sees it as his fault. You know, so helping him to process through that. The mother, meanwhile, is overtaxed because she's trying to figure out what to do about her son's misbehavior or acting out behavior in the school setting, while at the same time trying to work to care for Her family.
So many layers.
So many layers. You get what I'm saying? That web, that tangled web. And you know, she's challenged because she just wants the phone calls from the school to stop because she's scared that she's going to lose her job. You know, and so it's like you just said, it's so many layers. And of course, these types of experiences have occurred pre-COVID, but what we're seeing is that it's happening more frequently and more intensely in COVID.
And it's being exacerbated, right, by COVID, because it's happening all at once. And you know, particularly in the African American community, right, it's all about the village, right? It takes a village to raise our children. And so that village, so to speak, is a little bit of a virtual village right now. You know, we can't really send little Johnny or little Kim to auntie's house or grandma's house because of the risk of contracting COVID-19. So, you know, it places our families in a tough situation and puts so much more stress on our mental health and wellness. Does anyone want to add anything quickly to that before we move on?
I would just say that's one of our pillars in the Black community, is to be able to do what you just said, to be able to count on auntie and grandma. And so there again, like you said, it exacerbates our situation.
Absolutely. So apparently mental illness and behavioral health could be happening right now in a lot of our very own households. Let's talk about ways to spot these issues earlier than later. Dr. Bastian and Dr. Sims, tell us some signs to watch out for. We'll start with you, Dr. Bastian. Dr. Bastian, if we could unmute, thank you.
Sorry about that. One of the things that, you know, I stress initially is the importance of prevention and preventive strategies, right? So we can certainly talk about the things that are indicators that we're already in the trouble zone, but I think we've laid out enough to suggest that probably an assumption that most of us are somewhere on the spectrum of challenge right now, given all the variables in play. Would suggest a proactive kind of discussion with our children, with the older folks in our lives, with our friends and our loved ones about how are you actually doing really, might be an important sort of starting point in terms of making that invitation and creating space to have conversation about these things. But beyond that, I think it's important with the different subgroups that you've pointed to, and just a piece that I would have added to the last set of remarks in terms of women in particular, in what we're seeing with that population right now. We know, and you referenced in the beginning, that there's been a significant increase in domestic violence sort of issues, right? So there have been some unexpected sort of challenges in terms of having family cooped up in the same space for an extended period of time. And we love each other. We've talked about the values and benefits of the village, but sometimes the village can tax nerves and folks react in ways that are maybe not the healthiest. And so I think understanding what those dynamics of interacting with family look like, and how we can are
we there? Can you guys hear me?
Yes.
Dr. Sims, can you take over?
Sure. So Dr. Bastian was making some really good points about being proactive. So what I started to think about was, so, you know, when we talk about signs, you know, I tend to focus on kind of behaviors and changes in behaviors. But I'll start with, these days, a sign might be, you know, someone actually articulating, someone actually saying, I don't feel good. I feel sad. I feel lonely. I miss my friends and family. I find myself getting irritable and upset. If someone's able to articulate those things, I ask people to take a moment to listen and to allow that person to express those feelings and to think about how to respond in a supportive way. You know, that's a big part of you know, avoiding some of this conflict that we're seeing because folks are cooped up together. So that's one thing. But usually it's not that easy. It's easy to pick things out when people tell you how they feel. Things to look for are people who are isolated, someone who's very much a social person, who's out, who's active, that person may start to withdraw a little bit. Maybe they're sleeping a little bit longer. The sleeping patterns are disrupted. Their appetite is disrupted. They're just not making those phone calls and those connections with people that they typically would make. You might see an increase in substance use, a little bit more drinking, a little bit more using of other substances.
Mm-hmm.
And you may see some irritability and agitation. You see this increase in domestic violence. That shows you that is a change. These people maybe were not typically responding and acting and behaving in these ways, but now they're starting to lash out.
Mm-hmm.
So those are things and I always differentiate between children and adults, more so than I differentiate between men and women. Men and women, on average, may have some different ways of expressing ourselves, but I don't want to be stereotypical about it. Men and women can and do sometimes express themselves in the exact same ways, but children more often are unable to use words to express how they feel. So you really have to look for behaviors with children. Are they spending more time up in their room? They may be in class virtually and have to do virtual learning. Make sure you go in there and check on them. Don't just allow them to be in there for 12 to 16 hours a day, not knowing what's going on. So really looking at behavior changes in young people is really important.
Absolutely. This is the one time mom and daddy can be like, okay, you live in my house. You got to keep that door open.
All right.
I just wanted to add to Dr. Sims' comment about when someone expresses how they feel. And I think this is an opportunity for parents to really tune with their children and to model what it looks like to implement coping skills.
Mm-hmm.
So if a child is telling you, Mom, I'm really anxious, if they use that word, or I'm fearful that I can't go see grandma. If I go see grandma, I'm gonna make her sick. It's a time for a parent to have that conversation with their child saying, I feel the same way. Let's think of some ways that we can work together to manage how we're feeling so that we're in a better place.
Mm-hmm.
I think COVID has opened the door for all of us to talk about mental health in a more comfortable and relaxed way, because every channel you turn on, especially the news, they're talking about mental health, which is unusual, but I applaud and I welcome this conversation. So now maybe people won't be as hesitant or resistant to that conversation.
Thank you, Latrina. Great point. Dr. Batchen, did you want to add anything else? We know that you had a slight little connection snafu, but we welcome you back. Did you have anything else to add?
Yeah, I apologize for and miss part of what Dr. Sims was discussing there as I came back in, but I think he touched on a lot of the points in terms of looking for those shifts in what we consider to be normal kind of behavior, particularly with kids,
Mm-hmm.
As we're in the thick of this host of challenges. And I think all of those ways that we can look to temper down or to sort of look away from challenges that are maybe not the healthiest or things to look out for, right? If the diet and the types of things we're eating all of a sudden don't look like our typical diet, and we're sort of leaning more and more to the unhealthy food options, we're deviating from the things that we might do in the way of exercise and what things we could access in the way of coping, right? So we can't get together with folks, but if you used to be a person who turned to exercising in some way, but all of a sudden that's not a part of your routine, or music was a thing that is healing for you, but I haven't seen you access that at all in the middle of this really challenging time. Those to me are also sort of indicators when I'm seeing an absence of things that I know are kind of healing and restorative things for the folks in my world, but really looking for those shifts in norms that we expect, I think becomes really important right now.
Thank you. Thank you. Great information. Behavioral health issues. Ivan, Latrina, do you have anything to add from that perspective?
So it's kind of one and the same. People use the word behavioral health. So behavioral health is just mental health and substance use.
Right.
So when someone says behavioral health, that's what they're referring to.
Yeah.
But if we look at what the news and the research is showing us on the increase of alcohol sales, that's another big trigger, right? Or another big flag for us to pay attention to, because what will be the outcome of that? Once we get to whatever our new normal is our whole shift now going to be on treating individuals with substance use disorders?
Yeah, absolutely. If I could just add on a personal note, in 2015, I've spoken publicly about this. You know, I dealt with my own depression and suicidal ideation, and you know, that one social cocktail at home turned into two, and two turned into three. And when it's a party of one, you know, that's a problem. And so for parents, adults, and you know, even young adult children that live in the home, you certainly have to look out for those indicators, because that is the most unhealthy way, right? Or coping mechanism that we can use. And so we certainly want to be able to provide better, healthy coping mechanisms and really, you know, watch that within our parents and our children. Ivan, do you want to add anything to that?
Well, you know, just what you said, like, you know, just what Latrina said was looking at the cells, you know, and then you can see if you can look at your own behavior, you know, or look at your family's behavior, family members' behavior. If you see increased aggression or irritability, that's a sign, you know, of a substance abuse issue, maybe changes in the attitude of the person. I think it was Dr. Sims who mentioned the lethargy, you know, just like not enough energy, you know, feelings of depression that comes along with the drinking or substance abuse. You know, all of those things are behavioral health challenges that kind of like need to be noted. Okay, maybe I need to get some help with this.
Absolutely.
You know, I think that with our children, it was pretty much already mentioned that we need to validate. I really love what Latrina said about validating our children's feelings and kind of being transparent as parents and letting them know that, look, I'm human too, and I'm experiencing, we're all in this together, you know. But oftentimes, you know, like Dr. Sim said, children don't express those behaviors outwardly. So, you know, making sure that and in orders we are attentive to attendance in school, making sure that we're looking at the children's behavior in the school setting now that some of them are going back. You know, are they withdrawing? What's their attitude looking like, and all of that kind of things. And as mandated reporters, if we suspect anything, we do need to make sure that we report that.
Absolutely. And, you know, it breaks my heart. So this is, to me, it's good and bad. Good in the sense that now, right, we're able to kind of hone in on what's really bothering the children. And I think we see more of our educators, right, that are taking notice. But, you know, for so many years, especially Black and brown boys and girls, you know, when they're acting out, they just bad, right? You know, oh, there's bad baby's kids. You know, we've joked about that stuff. But 9 times out of 10, our kids, they're acting out, right? Or their behavior pattern has changed because of a result of some sort of past or present trauma, right? That's going on in the family. So, you know, I am grateful that these mental health conversations are at the forefront of culture and community. But I certainly hope, you know, that this will trickle down into our communities, and so we can get these kids the help that they need, as well as their parents. And so they're not written off as just being, you know, bad children or not great parents, right? Sorry, I felt that in my spirit that I just had to mention that, because I feel like that's been something that's been haunting our community for so long. And I'm glad we're addressing it now. Let's talk about, next I want to get into barriers to care. It would be great if once we put a name to it, we could get it treated. But unfortunately, mental illness doesn't work that way in our community. In the Circle of Trust survey, almost 2/3 of African-American respondents, 60%, indicated an interest in barrier-free mental health service from Fulton County, but only 8% had actually used these services. For the Black community, disparities in mental health are as stark as they are in other forms of disease and illness. One of the reasons for those disparities is stigma. We got to silence the shame. That's one of the main reasons why I started this organization. It just kind of rolled off of my tongue so that we could, you know, erase stigma as much as possible in our communities. Dr. Barry Mitchell, can you help us understand some of the history behind shame and stigma, and why how we associate it with mental illness in the Black community, and why it's so critical that we acknowledge these needs?
Yes. So that's a great question. I think it goes back to how others saw us and perpetuated that perception onto us, and then we internalize that, right? So we would call that internalized racial oppression, and then just an external racial identity is kind of what we call it in the psychological world, in the sense that if you see me as inferior and you've told me I'm inferior, and I believe then that I'm inferior, I have shame about that, right? And then on the one hand, there's this belief that, you know, we're the strong Black women and we're the strong Black men. And I loved how you started with us, which is, come on, Black queens and kings, which is great. But then there are those who don't see themselves as that Black king or queen. No matter how much we address them in that loving way, there is a dissonance between who they really are and what they have believed the message out there that Black people, Indigenous people, people of color are inferior. We are not the same as the other, the majority, if you will. And so that begins to affect how you see yourself, your motivation to engage, your motivation, your belief that you can do more. There was a powerful video that went viral. I think the young lady's name is Kimberly Jones. How Can We Win? I don't know if any of you saw that. But every time I see it, it brings me to tears. She talks about the rioting and the protests after the police brutality. And she responds to this idea of, you know, why are people rioting? Why are you tearing up your own community? And so I don't want to spoil it for you because it's wonderful. She passionately and eloquently, even with some profanity mixed in there, discusses why people of color would destroy communities that they live in because it's not ours. Like that's not our stuff. You know, and I was telling my 17-year-old about it. We were talking about it, and it's like, I'm from LA, not South Central, but I'm from LA. And I remember when the Rodney King riots, a large part of our community was destroyed. And I remember thinking, like, why would people do, like, why would you mess up your own stuff? Well, you can't get to Beverly Hills and tear up stuff over there because they're blocking access to it. But the idea that this shame and guilt that we're supposed to be these strong people, and then you have this, well, you're monsters, you are tearing up your community. Who are you? So there's these images that affect how we're told to be and behave, and the idea that, you know, and then the other thing, of course, is faith. You know, I'm a person of faith, but we have this belief, it's all or nothing, which we know is a cognitive error. There can exist faith, and there can also exist the need for help. And God has given each of us skills and gifts and callings to help his people. And so I'm thankful that I think somebody mentioned, or several people mentioned, the idea that what COVID has done has opened up the door for people to seek help. I have had so many people who have never been in therapy before come and seek out this benefit, this resource, because the most common phrase, I think Dr. Bastian mentioned it, but I've heard it so often this last 7 months or so, is it's a lot. I'm almost at the point of writing a book called It's a Lot, because that if I had a dollar for every time I heard that phrase, I could retire right now, I think. So being able to look at that and say, you know what, seeking help is not problematic. Seeking help is actually a strength. My belief has always been, coming into this field, that the strongest among us seek help. That to be able, like you mentioned, to be able to recognize and have that awareness and then do something about it. Like that takes strength, that takes courage, it takes resilience. And so, yes, we are resilient people for sure, but resilience doesn't mean you have to suffer. Resilience means that you recognize that there are things outside of you that you don't have enough resources for, which goes back to the race-based trauma, which says, you know what, I can cope with a lot of things, but when they begin to compound and compound and compound, and they just stack on top of each other, it's okay to get help. There's no shame in that. There's no there's no shame in that. It's a strength to be able to say, you know what, I need assistance. If you had a heart condition, you would go see a cardiologist. No difference here. No difference here.
Amen and amen and amen. I certainly can attest to that, because when I was thinking about taking my own life, and I come from a pretty successful career in the entertainment industry, and I was really ashamed to tell my colleagues and share with a lot of friends, and growing up in the Atlanta community, Southwest Atlanta. I didn't want to tell people that I thought about taking my own life, even though my dad had taken his own life. But I finally, my sister convinced me to call the National Suicide Prevention Lifeline, which is 1-800-273-TALK. And ding, 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 my pastor, Dr. Raphael G. Warnock, said, I will pray with you, but you also got to go to the doctor. He said, I need you to call your doctor this weekend. So I called my doctor, and he connected me with the psychiatrist. And I started on my antidepressants. And, being vulnerable, being transparent, that's what we're all about in the work that we do with Silence the Shame. And I'm proud of this younger generation, because more young people are opening up and not as embarrassed to talk about mental health. The issue is we need to make sure that they follow that through, right, and get the help that they need from a professional once they talk about it. But we're certainly starting to see, some of those barriers break down. So thank you, Dr. Barry Mitchell. Unfortunately, our shame isn't the only thing holding us back from receiving the care that we need. A recent paper published by the Substance Abuse and Mental Health Services Association reports that 69.4% of African Americans with mental illness do not have access to care versus 56.7% of the general population. Dr. Bastian, can you help us understand how racial bias is driving this lack of access to care?
Sure, that's a great question. I think you're definitely right to point out that there's sort of layers and levels to this issue of access and all the barriers that come into play. So once we can even get folks to get beyond that internal barriers,
that's right.
There are all of these issues around sort of accessing the system and finding quality and culturally responsive and appropriate care. And so we know that there are significant challenges that have to do initially with the fact that there is a limited number of folks who can speak to diverse communities in the workforce that's a part of this system of care, right? I think for psychology, it's 4% of the psychology workforce that's Black or African American. And everything that we know about the work that we do as mental health professionals suggests that the quality of that relationship between clinician and client and patient is critical. And an important part of that is feeling as though someone can resonate with and appreciate your experience. Not to say that necessarily it always has to be a ethnicity sort of match to do good work in therapy, but it matters that at least there's an appreciation for your unique sort of cultural experience. And we're not doing nearly enough work in either of those fronts. So we have sort of workforce representation issues that I think make it difficult for folks to feel like, even if I do get to a point of accessing care, am I going to end up sitting with someone who is going to understand and validate my experience, who's not going to suggest to me I'm being overly sensitive to be bothered about what happened with George Floyd and we're making a big fuss about it or whatever else, but someone who can actually relate with my experience. I can share, I do some work in the private practice vein where I just a couple of weeks ago had an African-American gentleman come to see me, and he shared that he had one previous attempt out west at seeing a therapist and just felt like there was such a cluelessness about his experience that he just sort of wrote off therapy as a whole. And here a decade later, he's coming back to give a go at therapy again around some of these same issues that have now magnified, that have now 10 years of entrenched patterns that we're working to sort of overcome, that really had to do with not feeling like there was an adequate sort of fit there. So I think there are huge workforce issues that are feeding into the access problem. But even beyond that, there's work that we need to do at tackling the bias in general in these systems, right? Are we structuring care in a way that speaks to everyone and isn't about necessarily getting one-on-one in a clinic? We're doing some work out of my research lab right now that's around engaging the local Haitian American community here in Atlanta. And what we've realized is that work cannot look like coming into my office for one-on-one therapy. If you want folks to actually be willing to start to step into these spaces. So we've had to get out into the churches and partner with, 3 local churches that have significant congregations of this group to think about innovative strategies for accessing this community. And so I think that sort of out of the box, innovative sort of thinking about how to meet community where they are instead of looking for them to adapt into our already flawed system is a big part of where we need to be headed.
That's exciting. I love the collaboration idea. I think it's something that, not only the organizations that are represented on this call, but, that we look at the community at large, other organizations within our community. We do need to start partnering a lot more and get out there and write and see the people and meet them where they at, as you said. I want to make sure that those of you that are viewing, I hope you are enjoying this amazing conversation this evening. If you do have questions, please make sure that you type your questions in, and I will start inserting some of the questions into the conversation for our panelists. I'm going to go to you next, Dr. Sims. I'm sure you have a good understanding of this next issue from your time with Fulton County, as well as your role now. Tell us how insurance or the lack thereof acts as a barrier, as well as some of the other issues keeping us disconnected from care.
Well, simply put, if someone can't afford care, unless they're in pain, they're not going to go get it. Folks don't go get help too many times until they're in crisis and they show up at the emergency room, which is not the best place to get care. You want to get ongoing care with an established relationship with whatever healthcare provider you're seeking care from. Building on the earlier conversation about bias in the healthcare system, the healthcare system is confusing. I'm a pretty educated guy, with a lot of training, and it's confusing to me. I was a psychiatrist for 10 years. So that's college, medical school, and shout out to Morehouse School of Medicine, and 10 years of practice. And I didn't fully understand how the healthcare system works. And it's only been these past 6 years in managed care that have really given me a true picture of how disparate, disconnected, how fragmented it can be. I didn't understand the access issues because there's pretty much a safety net in every state. I've worked at a safety net clinic. Fulton County Department of Behavioral Health is a safety net provider. Anyone can go and get treatment there, particularly Fulton County residents. So, but when you don't know, when you don't understand the system, and when there aren't people who look like us going back into our communities to explain the system and how to access it, that in itself is a barrier. But beyond that, our country has largely relied on health insurance through employer-sponsored health insurance. The Affordable Care Act did a lot to improve upon that. The goal was to expand Medicaid in every state. That didn't happen in every state, including here in Georgia. But co-pays can be an issue. High deductible insurance plans where you have a $2,000, $5,000, $1,000 out-of-pocket spend before the insurance starts to pay anything. People are making decisions about groceries versus care.
Yeah.
And what's going to win when it comes down to groceries and paying the bills.
The children.
Yeah, so those things are barriers. Also, you may have an insurance card, but it doesn't always mean what you think it means. Unfortunately, sometimes it's not until it's time to actually use your insurance that you realize maybe this or that service isn't covered. Or that this or that service has a differing payment structure. So again, and these things are frustrating. Your doctor writes a prescription for you, and that medicine's not on your formulary, so it's not covered. You get to the pharmacy, the pharmacist says, "Well, this isn't covered. It's $200 if you want to pay for it. If not, now you got to go back to your doctor and get them to write your prescription for something that is covered." So all of these things are very frustrating. If we don't explain to people what the expectations are and how things work, they just throw their hands up and walk away. So, and last thing I'll say is there's a stigma associated to going to kind of public health safety net providers. Sometimes people feel like, I'm here because I don't have resources and I'm going to be treated that way. I'm going to be treated like someone who doesn't have resources. And that's something, it's a big weight to carry with you. I used to have to spend a lot of time kind of cutting through that. The first 2 years I was at Fulton County, every time I went to a patient, they wanted to know when I was leaving because there are 5 doctors there, different doctors in the 6 months before I got there. Thank God I was able to stay for 9.5, 10 years, but eventually I left too. So that's another thing that has an impact on people's psyche when they're accessing care. So all of those things are potential barriers to care, but and then in the substance abuse world, people, the access to inpatient rehab is just not there across the board. That study about access to care, I think it was by SAMHSA or a substance abuse provider. So access to care doesn't always mean what you think it means. It's, there's outpatient care, there's residential care, there's inpatient care. There's so many different layers to the healthcare system. It's very confusing. And we just have to do a better job of explaining the system, encouraging people to access it, but also improving the workforce and improving access to different levels of care.
Wow.
It's a lot.
No, it's a lot, Dr. Barry Mitchell, you're pun intended, right? But yes, I wish we could keep going. If I tell you I get 1 call, I get 10 calls, Dr. Sims, asking me about, how, what insurance does this clinician take, or how do they find out, if they can access services? We need an entire panel on that. That's something that Silence of Shame is going to start doing once a week on our IG Live. Is I'm going to go live with different clinicians. So I hope you guys will come back and be able to share so we can have that content live and get more information out to the community as we continue to all partner together. So let's talk about treating our mental health, from self-care to psychiatry. I'm sorry, did anyone want to add anything to that? You want to add something, Dr. Barry Mitchell?
Really quickly, I will just say it's really difficult. Managed care does not really cover if you have simply a mental health disorder. If I want to go for depression, I'm going to be hard pressed to have my insurance pay for that. Now, if I have substance abuse, if I have 2 disorders occurring at the same time, usually substance abuse and depression, they'll treat it. So it's really hard too. That's the other thing about kind of navigating that what's covered and what's not covered is the idea that finding programs where insurance will pay for just a mental health problem is difficult. And then getting beyond 30 days, now I think it's 28 days worth of coverage is even more difficult. So we're like trying to find the purple unicorns in this system. And it's really difficult because to say to someone, like it's been mentioned, the relationship is so important. So if I'm at a program from 28 days, in 2 weeks, maybe we make headway, and then I'm expected to leave 2 more weeks later, we've just really gotten to scraping the surface of what I'm there for, right? That the substance is really there to help me navigate all of these mental health issues that I'm dealing with, depression, anxiety, race, stress, whatever the case might be. We can't even get to that because you're focused on how many times do I drink?
Yeah.
And then by the time I tell you it's time for me to go because insurance is not going to cover it anymore. So there's just so many things that hopefully we can get changed as we really begin to really see the idea that mental health is just as important to our physical health, and the relationship is so strong.
Oh my gosh.
And if we give it the same attention, we'd make a much better society. Yeah.
Key word for the night: integrated care, people. This is what we need. It is one and the same, integrated care. So let's stay with you for a second, Dr. Barry Mitchell. Let's talk about self-care and at-home coping strategies. What should everybody be doing right now? Share with us some coping strategies we can put in place for the family at home.
Thank you. So I would say the 3 B's. Breathing is the best tool. I teach my patients when they first come in. Breathing retraining, your breath is always with you. Yes, you need it to live, but it is a great resource to manage stress, anxiety, and to bring about the relaxation response. So There are many different ways to do it. The simplest way that I like is taking a normal breath in, holding that breath for a count to 2 to 4, whatever feels comfortable to you, and then slowly letting that breath out, and then repeating. So a normal breath in, holding it for a count to 2 to 4, whatever feels comfortable to you, and then slowly letting that breath out. That brings about the relaxation response. But the caveat is you have to do it when you're not stressed. So you are training your brain to look for the relaxation response so that when you become distressed, you'll think to use it. And then over time, the brain will automatically kick it in because it says, hey, that thing works. Let's do it. So breathing. The next one is boundaries.
I'm glad you said that because I utilize the 4-4-8 or either the 4-7-8 breathing technique.
Yes.
Popular yoga. But thank you for reminding me to do it when something isn't, necessarily wrong, right? Yes. Just like therapy, guess what? You can go to therapy when something isn't wrong. Don't just go to therapy when you have a problem. Therapy should be like,
exactly.
I got a grocery store. Sorry, I just wanted to put that out there.
No worries. So breathing retraining is great. The next one is boundaries. So right now, a lot of us have become caregivers, caretakers, even a lot of mental health providers. We have been taxed. Thankfully so, because again, people are seeking out our services, which we're grateful for. But even us, I've had so many conversations with a group of Black psychologists, female psychologists. We have a group, and we've been relying on each other, consulting, comforting each other, because it's been a lot, right? And so the idea of setting the boundaries, I have since reduced my schedule because I realized even working from home, trying to see the same number of people I was seeing before, it's just not the same because I'm in that same one room where before I could go down the hall, talk to my colleague, stretch my legs. Nope, I'm in the same space. So I realized for my own self-care, I had to reduce my schedule so that I could be the vessel that people needed me to be. So boundaries. And that can be just saying no. So if somebody says, hey, can you go do this? Can you do that? The word no is a sentence within itself. It doesn't need anything else.
Sentence. Hello.
It is a complete sentence. Yes. Period, as the people say. So setting boundaries, and then finally blessings. When we can focus on the things that we have to be thankful for, it gives us a whole new perspective. So yes, 2020 has been a lot. It has been very challenging on many different levels, but there are still things that we can be grateful and thankful for. And as we count our blessings, as we set our boundaries, and as we breathe, those 3 things, the 3 B's, will help us get through this time.
Those are awesome. I got to write those down. Thank you so much for that, Dr. Barry Mitchell. I'd like to quickly add, in my book, I talk about cope as well. And so the C for coping is to care for yourself on a daily basis, right? Especially as parents and caregivers, we forget to take care of ourselves. So if you can remember to provide some sort of care for yourself on a daily basis, that will go a long way in terms of your emotional health and wellness. The O in cope is for being open and sharing your feelings. We talked about earlier, you see friends or colleagues or family members and you go, how you doing? And we say that to be polite, right? How you doing? And you really don't expect anybody to kind of stop and talk at times, but just say, how are you feeling? Right? So being open to sharing your feelings to others, I think, can go a really long way. And then the P is for seeking professional treatment or prayer. Again, I have this prayer pause I do twice a day. But if I need to call my therapist, I don't substitute one or the other. It's professional treatment and prayer. And then the E is establishing a support circle. I like to ask people, just like in the NBA, who's in your starting 5, right? Because, sometimes you have to compartmentalize friendships and relationships. And so you need some folks that are in your support circle that can come from a place of empathy and not sympathy. I don't need anybody feeling sorry for me because I'm depressed or I've lost a family member and you're feeling sad and awkward because you don't know what to say to me and you don't want to say the wrong thing. Find those folks that you can call on when you're having a bad day or a bad minute or a tough time. You really do need your support circle. Ivan, what would you say, or what are some tips that you can share with us and keeping in mind of how to help our children and elderly relatives to cope?
I think you all have said so much. So just building on top of what has already been said, continue to, if you can, seek that professional help from a behavioral health clinician. I think that that's important. I do myself. We're encouraged as clinicians to check in with a therapist on a regular basis. So that's really important. If for children, if you find that your child has some type of diagnosis, for example, ADHD, and you parents see that my child needs extra support in school, make sure that you bring that up to the counselor that you want to see about establishing maybe a 504 plan for your child so that interventions could be put in place to support your child in the classroom. By law, educators have to collaborate to ensure that they're meeting the needs of all students in the classroom. So that's important because parents can oftentimes feel overwhelmed, not knowing what to do, and they feel like they're by themselves. Talk to the counselor, talk to the social worker about that. Eat with your children, whether that be breakfast or dinner, as much as possible. I think that's important because you can build conversation, dialogue, and relationship with your child. And if it's not around food, maybe some other type of activity. Definitely consider using some form of a behavior modification plan or system with your child where you try to catch your child doing the right thing and affirm them and praise them when they are doing the right thing. Also look into providing consequences. Take that video game away when they're not doing what they need to do, so they feel a little pain. But you can modify that behavior without getting overly stressed. You can remain calm, keep your calm, and modify and change behavior all at the same. And definitely maintain those routines, with your children, especially during this time, especially if your children are homeschooling or doing this online schooling. You absolutely have to have some routines in place to support them. They need that. We need that. Adults need that, and most importantly, children need the routines to be in place. With the elders, it goes, hand in hand. Again, help our elders get that attention, that care that they need from health professionals. Support them as much as possible with getting the exercise. We call him granddaddy. We take granddaddy out, let's go for a walk. Let's do something together so that you can get that exercise that you need. Include our elders in the household routines, the cooking, the cleaning, the repairing, whatever that may be, so that they feel included. And if they're not in your household, it's definitely important that we connect with them any way we can through these video conferencing means, through telephone, anything that you can do to connect with your elders in your household is important.
That's right. You got to keep Nana and Pop active. Keep it moving.
That's right.
That is important. Thank you so much, Ivan. So we have about 15 minutes left. This has been an amazing panel discussion so far. I hope all of the viewers are enjoying the information and, more importantly, taking it down, taking notes, and you will be sharing that information within your own households and family members. I want to shift quickly from self-care to self-care/at-home care to professional care. Pre-COVID, a Congressional Black Caucus report released late last year noticed that suicide rates amongst Black youth doubled, as I mentioned before. I'm sorry, I apologize, having some issues here. Dr. Sims, how do we shift from self-care, at-home care to professional care as it relates to children and adolescents?
Just generally speaking, when in psychiatry and in mental health, behavioral health, we really focus on functioning. And so, you'll hear some people voice concern about kind of I'm forgetting the term, but like over pathologizing everything. There's normal sadness. There's a normal range of emotional responses to a variety of things. But when your emotional responses start to impair your functioning in some way. If you're no longer functioning at work or at school, or you're missing obligations, there's conflict or strife in your interpersonal relationships, and this is really preventing you from kind of living the way you should be living and achieving and the way you should be achieving. That's the time to go and get some help, some professional help. I think there's never a time to stop some of the things we've talked about in terms of self-care, healthy diet, prayer, whatever your spiritual practice is, exercise. All of those things help to reduce anxiety and depression and help you to be a more stable emotionally. But again, when those things are not enough and you're not functioning, that's the time to really reach out for some professional help. And that help is, if you have insurance and you are depressed or anxious, or if you don't have insurance and you can go to a safety net provider if you don't have insurance, because they'll see you, like Fulton County's Department of Behavioral Health will see you regardless of your ability to pay. Anyway, you can get help for those things. And if you don't get help, if you feel like someone said, well, you're only depressed, so we're not going to pay for that, you need to call your insurer and complain. There's someone that, like me, who's there to fix that kind of thing, because that is unacceptable. All right. It gets confusing when there are different levels of care, and that's where some of the issues come in. But if I'm depressed or anxious or just stressed out and I need someone to talk to, help is available. When your functioning is impaired, that's the time to go get some help. Don't wait till someone is having thoughts of suicide.
Right.
Don't wait till someone hasn't gotten out of bed for 2 weeks and hadn't had anything to eat and they're dehydrated or they're falling out. Don't wait for that. Look for those signs that we talked about earlier. This person is off, they're not functioning right. Let's go get some help, either myself or if family, you can really rally around, whether it's young people or adults. Family, that's where family can really step in and support people and getting the care that they need.
Thank you, Dr. Sims. Latrina, we talked earlier about the lack of access to care facing our community, but from what I understand, Fulton County has done a lot to try to remove some of those barriers. Talk to us about the barrier-free adult and child mental health services offered through Fulton County.
Absolutely. And Dr. Sims has done a great job today advertising our services and letting everyone know that we do have, that is our goal, is to ensure that individuals, citizens of Fulton County, have access to barrier-free services. What does that look like for us? We don't want your inability to pay for services to be a barrier for you not to obtain services. So if you are in need of mental health or substance use disorder treatment, please reach out to Fulton County Department of Behavioral Health and Developmental Disabilities. If you are a Fulton County resident, if you're not a Fulton County resident and you just need us to connect you to your county resources, we're there. We can provide that service to you as well. But we provide outpatient behavioral health services. What does that look like? We provide individual therapy, family therapy, group therapy sessions. You can have a session with a psychiatrist like Dr. Sims. So if you're watching today and you really like him and you want to see him, reach out to us and we'll get you connected to Dr. Sims. We also have a service that I find very interesting, and Georgia is actually one of the innovative states around this service, which is your peer services. What does peer services mean? That means that I have lived the life of dealing with mental illness. I'm in recovery, and now I'm ready to turn around and help the next person take that same walk that I had to take, but I have the life experience. So I recognize things in you that I experienced as well. And so we find peer-to-peer interactions to be very, very, very impactful amongst our individuals that have mental health or substance use disorders.
That's awesome. And is there a website, or did you mention the phone number, Trina?
Our website is www.fultoncountygA.gov.
Okay, awesome. Thank you so much for that.
Oh, thank you. Shanti, I wanted to add something earlier. We were talking about self-care and everyone did an excellent job with providing effective coping skills and strategies for our viewers to implement in their lives. But the thing that I always encourage people to do is first you have to know yourself. You have to know what brings you peace, what makes you happy, not based on external factors, what makes you happy. And then you'll be able to identify those coping skills that have been shared with you today that are most impactful for you.
I love that. And Latrina, I often tell people, you know that book, what is it, The 5 Love Languages? Yes. I've never read it, but a lot of people love it. But I often say, you know, what is your love language for mental wellness, right? To your point, you got to know what makes you tick, because your love language for wellness could very well be different from your spouse's or your children. You know, certain things I'm just not into that another family member may be into, but you got to figure out, you know, where you find your peace, to your point. So that was excellent. Thank you. This has been so incredible. So much wonderful information. Thank you all the viewers for hanging in there with us. We have about 8 minutes left. For our last topic, I like to discuss the future ahead. Dr. Bastian, what do we need to be doing as a community to address mental health challenges brought on by COVID-19? Can you share with us some of the work that you and the Morehouse School of Medicine are doing to engage our at-risk communities? If you could unmute, please, Dr. Bastian.
Yes.
Thank you.
All right. So great question, and I appreciate the perspective of thinking at a community level, because often so much of the work that we do is at the individual or sometimes couple family level. But this kind of an event, of a challenge, really presents challenges to the collective community that we have an opportunity to respond to in a more substantive way. One of the things that we recognize and are doing a lot of work around at Morehouse is the fact that we need more hands around this work, right? There's significant workforce challenges we've talked about that are probably even more pronounced when it comes to the mental health workforce. And so what we've really been looking to is something that the international community has been at for a long time, which is looking at how to train up lay folks, how to train up, how to sort of share certain aspects of what we do as mental health specialists with other folks who are engaging the communities that we care about, to be able to at least provide some level of attention to mental health issues. And so some of what that's looked like for us has been partnering with the faith community and training up pastors and church leaders to be able to do some basic level sort of awareness and education around mental health, and to facilitate referrals for where there's a need for added supports. We have a program for training up high school community health workers that we've modified to address mental health concerns, and mental health concerns related to COVID is a part of what we're adapting that model to now. So looking to our young folks to see where they can be engaged in meeting the needs of their peers and of their broader community. I appreciate what's been shared about the peer support sort of community, and that perspective of empowering communities of folks who've dealt with these issues firsthand to take a lead role in helping to address these issues. Because truly, I think when it comes to the ways COVID is challenging us in terms of mental health, I really do think we're just starting to scratch the surface. We're not going to see the full impacts of this thing until a couple years out, and we don't have enough specialty trained folks to respond to that level of need. And so I think being creative about who's there, understanding that we can have the right message, but who's the right messenger? Who are the folks who have the credibility, who have the trust, where folks don't have to navigate some of the challenges that have been spoken to in terms of our systems, to be able to at least get some basic level of care, and then help to support with funneling folks forward where there's a need for more intensive supports. And so those are some of the things that we've been looking at closely at Morehouse.
Amazing. And lastly, in light of your work in mental health capacity building and in leveraging large-scale emergencies as a pathway to addressing pre-existing mental health disparities, how can we use this crisis as an opportunity to improve the mental health infrastructure in this country?
That's an excellent point. I often share with folks that part of what led me to focus my work around disasters and being involved in things like the earthquake in Haiti back in 2010, or Ebola work in West Africa, which folks wonder, that's pretty depressing. Like, why do you keep putting yourself in these situations? And I think part of it has to do with that balance of the challenge, but also the opportunity that these crises present. my experience has been that at no other time do we find the level of political will that we need to innovate, to galvanize resources, when these challenges are so in the face of decision makers that they can't look away from it. We have real opportunities to innovate. And I think we're starting to see all of that. I mean, even at Morehouse School of Medicine, we've been pleasantly surprised at folks who are coming around the table to talk to us about how to leverage our track record engaging community to make a difference with COVID and COVID-related mental health challenges. And so I think as we're tending to the immediate sort of emergent issues, having an eye to how we build the infrastructure for sustained supports makes a lot of sense, whether we're thinking about what's that, cadre of folks that can be a supplement to the formal mental health workforce that we can think about, who are the folks that we need to bring around the table to help us to think about how to be most effective in engaging communities. How do we galvanize resources and get policymakers to help us overcome some of these access barriers that we've talked about? I think we have listening ears. Folks have pointed out all over the news, you're hearing about mental health, and this is a ripe time to strike with creative ideas about how to overcome mental health challenge at a population and public health sort of level.
Absolutely. And to your point earlier, this is something that we're going to be discussing, for the next, few years or decades, right? As we continue to face these unknown challenges, right, in our country and in the world. So this will end our conversation, everyone. This has been so incredible. I want to mention to the viewers that we have a helpful info doc that's coming. If you registered for the panel, you should be getting it via email tomorrow. Next week, we'd like for you to tune in on December 9th at 7 p.m. Join Alive and in Color for Holding Down the Home, Managing Economic Hardship. Also visit aliveandincolor.com for the latest information on COVID Convos and how to beat COVID-19 with the truth. And I would just like to offer silencetheshame.com as a resource. We also have a podcast that's available on iTunes, Google Play, and SoundCloud with over 40 episodes. And some of our experts that are featured on here today have been featured on our podcast. And follow us at Silence to Shame. We interview a lot of clinicians and put out a lot of helpful information for the community. And I just want to again thank the Gathering Spot, thank the BLK+Cross, Alive and in Color. And thank you to these incredible, let's give a round of applause to our esteemed panelists. You guys are incredible. Briefly, do you want to shout out how we can follow you all? Latrina, how can we reach you?
www.fultoncountyga.gov.
Dr. Sims?
I don't really have a social media handle. You'll see me around.
Okay. Ivan, how can we follow your organization and yourself?
www.barclaybehavioralhealth.com, and also you can find me on Psychology Today and many of those
Dr. Barry Mitchell
platforms.
At Dr. Felicia Berry on Twitter, Facebook, Instagram at Dr. Felicia Berry, and then my website is drfeliciaberrymitchell.com.
It's at my difficult first name, Gilberte, Gilberte, followed by my last name on Twitter. And Morehouse School of Medicine is www.msm.edu, where you can learn more about our programs.
Awesome. And I am Shanti Das, your host for the evening. My book, Silencing My Shame. You can check me out at www.shantidas.biz or at shantidas404 on Instagram. Thank you guys so much. Again, make sure you take time and take care of your mental health. Good night.
Good night.
Good night.